let me tell you. So this was our breast cancer population. I'll show you. I think I have it around here somewhere. Yeah, I have a visual. I'll show you in a second. But so we followed 90 consecutive patients. By the way, this is published in the Breast Journal. And actually, the head of research out of MD Anderson in breast cancer for the last many years, a really lovely guy who was running UCSF's breast cancer unit, Dr. Debu Tripathi.
Yeah, we know him well.
Yes.
Wonderful man. Yeah.
Yes, co-authored with us.
Oh, wonderful.
And reviewed all of our data independently. Anyhow, we followed 90 consecutive patients with advanced metastatic breast cancer, diagnosed over a 13-year period. They received from us chronomodulated chemotherapy and very aggressive, not invasive, aggressive, integrative and nutritional treatment. We followed their records and followed them clinically and determined prognostic factors like hormonal receptor status, their conventional treatments, how long they survive from the time they develop metastatic disease. Their median age at the time of metastases was 46 years old, in which many of you probably recognize that this is younger than most breast cancer patients. So our average patient at that time was younger, and it implies a much greater mortality risk. 96% of our patients had relapsed into advanced disease before seeing us. So they were already stage 4 advanced disease before they walked in our doors. We compared their survival with that of breast cancer patients in a few other studies that were comparable to our population. Our 90 advanced breast cancer patient population's median survival was 38 months. Median survival means that's when you're at the 50% mark. 50% of the patients are no longer alive, 50% are. And it's a very stable number used in research statistics. Throughout our study period, the 1990s, the median survival reported in metastatic breast cancer trials generally ranged from 12 to 18 months, with just a couple of studies that went 21, 22, and 23 months. None of them reached our 38 months. Our 5-year survival was 27% from the center, and the comparison groups all added up, matched up to about 17%, despite a higher proportion of younger and relapsed patients, a much more advanced group. So for advanced and younger patients, with thus a higher risk and a worse expected prognosis, our patients in the study even today in 2023 have still among the best survivals for advanced metastatic breast cancer. This is actually that data. A little hard to see. The median survival is right here, and that's how you kind of determine off of a Kaplan-Meier the 38-month median survival in this patient population. This is us, and each one of these is colored based on what the metastatic site was, or the couple of metastatic sites. Green is bone, lung is blue, liver, and visceral. And you can see the other groups that we looked at. The Munich group, right where my finger is the SEER data. It's the major data that's used as comparison across the globe and has for many decades now. There was a Louisiana group and a Texas group as well. And you can see it even when you match up to the particular metastatic site, none of them come close to the survival of our patient population. You would think it would have been easy for us to have gotten funded by various institutions and stuff after this kind of data. Not the case whatsoever. Just so you know, 3-year survival percentages on the group, 9% were alive in one of the trials, one of the groups that I just showed you, 28% in another, and 30% in the Louisiana group. And our group was 52%. So we pretty much came close to doubling the rest of the population with that. This is really one of those patients. She's still alive today. She's out since 1999. So she's 24 years out. She's alive and well and free of disease, and has done very well, and still stays in close contact with us.